Good day, everyone. My name is Rudy Vargas, and this is Senior Matters. There comes a time in many individual adults' lives when they realize that it is becoming increasingly difficult and hard for them to complete their daily tasks without assistance. Although this lifestyle change is one that few welcome, it is a reality for many seniors. Men and women wanting to remain in their own homes often seek the help of a home care agency to meet their needs. Home care nurses and assistants perform a variety of tasks that aid their clients. The level of care needed will determine whether or not a home health care worker will be in home caring for its occupants full-time or part-time. There is a lot to consider before deciding to bring a caregiver into the provider to provide senior home care at home. There are a lot of questions just like, how will my mom, dad, or loved one react to this? How do I trust someone I don't know with such tremendous responsibility? How much is this going to cost them? How are we going to pay for this? Today, all these questions will be answered by one of the experts in home care services. It is my pleasure to have Amy O'Grady, the Director of Nursing for Eden Home Healthcare Services. Welcome, Amy.
Thank you, Rudy.
So, my first question is,
Yes.
What is really the mission statement of a home care services for the client? And in what way, just to make sure that this agency abides to this statement?
Okay, that's a good question. Well, each company has their own mission statements. Eden's mission statement is to provide an unsurpassed level of care, to promote independence and enhance quality of life to seniors in their communities and in their homes. And we really bring that mission statement to life by carefully selecting our staff, making sure they align with missions and values and goals overall of the agency, and to make sure that they're in it to provide the best quality of life for our seniors.
How important is home care services? I notice a lot of family members are not really into this. Are there a lot of doubts about home care services? Can you tell us how important it is to have home services at home?
Home services are extremely important. They're very beneficial for all kinds of people. We're seeing an increase in promoting aging in place. CMS has encouraged, they have a statement that's coming out left and right. It's the care at the right place at the right time, which often can be in the home. There's a lot of other programs coming out, hospital at home, where they're piloting different services, but there's a lot to be said to recover, recuperate, and be cared for in the place you want to be the most, and we can bring those services to you.
You mentioned a lot of aging population in the next couple of years.
Oh,
Like
yes.
it's a
Yes.
tsunami of
Booming. The silver tsunami.
Silver tsunami, yes. So in what type of clients that your home care services accommodates, and how do you screen this and approve them that you will be able to take care of them?
Well, we screen, it begins with the initial phone call, whether that's from a discharge planner from a facility, whether it's from a loved one from the community. Different other healthcare professionals may call and request a screen. So we do take mostly seniors, but adults with various needs, a lot of post-fall injury type patients, which can range in need, but we would not take anybody that we could not manage at home. But we also have other companies that we could contact to help coordinate a better service if need be, but we haven't come across that situation yet. So it is essentially talking to them first, and then a nurse going out, meeting them, and getting to interact with them one-on-one, really to see what the needs are and make sure we can best meet them.
Sure. And based on your statistics, can you tell us the 5 most common diagnoses that was referred to your care?
Number 1 is people recovering from a type of orthopedic surgery, whether it was an elective total knee or total hip replacement. And they've been to the hospital, the rehab, and then home. We have a lot of, like I had said, fall-related injuries, which can really vary in what that need looks like. We have diabetics is another top diagnosis, CHF, congestive heart failure, and wound care, IV medications, all different needs.
You mentioned about wound care. Do Do you have a wound care nurse that go to the home? Are you specialized to do all the services for wound care?
Our nurses are trained in all of the wound care aspects. We have an order from the physician. We're not flying on our own and doing things without the direction of the doctor. If there's a special need, we do collaborate with wound clinics and specialists like that to provide the care they need.
In my experience, it's always been difficult to refer to home care services, especially with IV or or wound treatment, especially twice a day or twice a day IV or twice a day treatment. And what is your intake to this? And does it really affect in terms of monetary on your end, or it's just an inconvenience for the home care services to go to home to do twice a day IV or twice a day wound treatment?
It's not an impossible service to provide. Other companies may have their own reasons for not being able to provide or not offering that service. Right now, there's a revamping of the home health care scene where a lot of the IV infusion needs, where it's twice a day, the wound care that's more than once a day, is going to be reimbursable. It's still something we'll meet. If that's what the patient needs, that's what the patient needs.
Okay. And what are the state and federal requirements needed by the home care company?
To be a Medicare certified home health agency, the state requirements, it's really more focused on Medicaid or Mass Health Services. That's in CMR 403, and it really mirrors what the government requirements are for CMS level. And there's Medicare conditions of participation, which were all also overhauled in 2018, that brings the client, the patient, really in as a partner in the home care setting.
So I mentioned about specialized services a while ago. So can you tell us what are your special services that Eden Home Healthcare are doing that would set you apart from the other home care company?
I just think that we're great and we stand apart on our own, but we do have some unique programs and things that we offer. Well, first, it's a physical therapist-owned company, which I'm sure you can appreciate. We're very customer service driven. There's a lot of collaboration amongst clinicians, and we try to remain as consistent as possible so the patient has the best outcomes, keep the same therapist, same nurse as much as possible. We offer private care management. We offer in-home social work services for cognitive behavioral therapy or psychotherapy. One of the biggest things is anodyne or infrared therapy, which that is a medication-free option for pain management. It helps promote circulation and can address things such as conditions relating to diabetic neuropathy, which can lead to falls. We've had some really good outcomes with the use of that.
That's very interesting. And what is the perception of this patients? Are they accepting this kind of pain management?
Oh, they are. I had to try it myself so I could speak to it, and it was fantastic. It's like this. It's a different type of the warm heat. They're pads that go. Actually, you can see it on the screen. They're pads that light up red when it's plugged in, and they are just placed on the area that it's being used for. It's about 20 minutes, 30 minutes of treatment, and it just feels like great warm heat. And the effects last for about 4 hours after. And it can be beneficial for people with wounds, with all different types of conditions. And they've enjoyed it and it's helped them.
Do you need a doctor's prescription for that, or?
Oh, everything we do is under the order of a physician.
And how was is doctor knowledgeable about this kind of pain management?
The doctors that we've worked with so far, we have all the information on it, what we teach the patients about the service.
Anything that would treat patients good, right?
Exactly, yes. Especially with the opioid crisis and all of that, it's a really great option for people.
And so what are the other healthcare professionals you have in your team, and what are their specific role for the patient?
We have a great team. We start with nursing. Nursing goes and does the initial visit for the most part, and they really kind of quarterback the whole case and the care and communicate amongst the team. We have wonderful physical therapists. They're going to function to help with any balance issues, endurance, strengthening, things like that. Mostly what I tell people, waist down is what they work on, but they do many other things. We have occupational therapy as well. And again, I tell patients, waist up for the most part, accessing your home, going shopping, for things, reaching for things in your house that you wouldn't be able to do after your surgery. They just help you acclimate to being home. We have a medical social worker, and she does community resource accessing. She helps with some psychotherapy if people are having a hard time adjusting to changes or limitations they now have to live with. We have home health aides, which would help with personal care, and speech therapy for swallowing or cognitive deficits after a stroke or something like that.
Do you have NP or doctors on call?
We work with a lot of nurse practitioners and doctors, and they're always, we can access them just as easily.
Okay, perfect. And I know we see a lot of abuse at home by healthcare providers. And some of those reasons is because they're not checked
Right.
Correctly of their background, basically. So what is your process in hiring your staff, and what is your pre-employment screening like?
Oh, it's very, very thorough. Everybody is screened through a 2 to 3 phase interview process, which our interviewing is a great combination of really digging in and probing to somebody's emotional intelligence as well as their skills. We want to make sure that they're caring, empathetic, good communicators, can take constructive criticism, all of those types of things. But everybody is fully vetted, background check, references, everything like that to make sure. And we really are, management-wise, very involved. So we make sure that there aren't any issues in the home, or if there's any question, it's addressed right there.
That's good. Can you please tell us step-by-step example, a skilled nursing facility refer a patient to your company for home care services? What is the first step and so forth, and how soon can you place the services?
Well, the initial steps vary from facility to facility. Some will contact us as the patient arrives and they know what provider they want, if they had services with us or they're requesting us in general. Some will hear from as they have a discharge date and they give us the basic information over the phone. Some will go in and we screen and get to meet them in advance, which is great. We offer going in to family meetings to help that discharge planning process so that the torch is handed off and it's a seamless transition home.
So what is your opinion about I work in a nursing home, and the social workers always refer services to home for home care services. And there are a lot of complicated, complex patients that we have that we feel that it is more important that the home care services will be involved in the discharge planning. Some home care services would say we're not going to touch or see the patient unless he's home. And are you open of coming to a nursing home and do a discharge planning with the patient that's referred to you? Is that a Medicare regulations not to be in a nursing home before discharge, or just is it being restricted by the policy or what?
No, it might be more of a policy thing, but we can, I mean, you can't lay hands on and treat and bill and touch it, do anything like that, but certainly I've gone in and met people as I'm screening and gathering information. I think it makes people a lot more comfortable when they meet somebody that they're going to see or be involved with after they get home. And you can answer some of those questions right then and there, which helps the facility, that social worker that's got 17 discharges in one day. It helps, it's a good transition.
I know you made care plan, but how do you revise and update your care plan?
So as we're going through with the nurses doing a visit, the nurse knows what the goals that are established are, and the goals are initially created by what some of their problem areas or deficits are. In everybody's evaluation, there's always a patient-stated goal, which is I want to get better, I want this, and each time they're reevaluated, that goal is added, their quote-unquote words and what they want from this. But it's updated every visit if a goal was met, if it was not met, but it's a constant, it's a very fluid document.
Perfect. And how do you match your home health aiders, professional provider, to your patient? I know there's a lot of things that even in a nursing home, some CNAs doesn't match with this kind of patient. They have to shuffle the staff to treat or to see the patient. So how do you match that? Like, just to make sure you have the right person, let's always say attitude or behavior to treat the patient. How do you match that?
And that could go for every discipline.
Right.
So typically, we train the nurses to do the same thing, that you, upon initiation of care, develop that rapport with the patient. Nursing is the #1 trusted profession for 17 years in a row. So we become that person for the patient. If they just aren't connecting with the therapist, with the home health aide, whatever the problem may be, we've always encouraged, just let us know, we can swap things out. We try to match up based on their needs that we know initially,
Right.
and that, for the most part, does work.
That's
well.
good. So what training do you think as a home care company should provide to their staff in relation to emergency cases? And there's a lot of emergency cases that, some of the home care services doesn't really know what to do. So do you think what kind of training that they need to prepare for these cases?
For like a complex type case?
Yeah, like an
or
emergency case at home. The suddenly patients just collapse in their care, or some patients just happen to be unconscious during the treatment sessions. And what do you think are the most important training that they have to learn before become a home healthcare professional?
Yeah, it can be difficult if you don't have that experience being in an inpatient setting where you have another team to go to, because you are there on your own and you have to make those judgment calls based on what's going on with the patient. But calling if they're unconscious, responding in an emergency is calling 911 or whatever. We also have an emergency preparedness plan for each patient as well. So we have that very accessible in our cloud-based software right on our phones or tablets in the home, so we know what their emergency and their advanced care plan directives are and everything like that.
Perfect. And there are instances that from home, the patients go straight to a nursing home and they don't refer to the hospital. What is your intake about this? And do you have any criteria that you will decide, the patient is declining, the patient is not doing well, but I think we're not going to refer the patients back to the hospital, but just go back to the rehab facility where they came from. What is your opinion about this, and do you have any criteria in doing this?
I can't say that there's a set criteria across the board. I think it's a great practice, especially if it's returning to the same facility that already know the patient. The patient's already familiar with the setting. The hospital can take care of the acute needs, but if somebody is failing at home, not doing well in more than one domain, and we as a team feel like we need to have this conversation if the patient's agreeable. For Medicare beneficiaries, they have 30 days post-discharge to return on their Medicare Part A benefit. So I tell people that when I meet them in the nursing home, I said, there's kind of a return policy. It's 30 days and you can return and you reactivate your Medicare. So I think that's ideal versus going to the acute hospital with more germs, bugs, sicknesses. You could get worse.
Right.
Things like that. So we do try to coordinate it.
Perfect. So how often do you communicate with your physician or primary care physician of the patient? How do you update in terms of patient's progress or current status?
If there's any changes, they're all notified immediately, all physicians involved in care. They're regularly updated every 30 days with therapy, their progress, what their goals are, how much longer, and then every 60 days overall through a nursing interdisciplinary view of the patient.
So what is the allotted time for the physical therapy, OT, speech, or nurses involved in patient care?
That's all very much based on the patient's needs, similar to in the nursing home setting where they have to meet a certain criteria that's been established by their insurance, by Medicare, and that's what we go by and we give them the best that we can provide for what their needs are.
Okay. And what is your discharge criteria? Like you think, he's ready for discharge from home care services. So do you have a set criteria when to discharge the patient?
During the initial assessment, during reassessments through the interdisciplinary view, we look at reasons for what discharge criteria would be, whether it's self-management of a wound, a IV, whether it's stabilizing X condition, but there's different things like that would be set criteria. But if we look at all of their goals, and it's really talking to the patient too. How are you feeling? Are you ready for outpatient?
Do you do family meeting with this before discharge, or?
We have, they have, the patient is notified, they have to be notified within at least 48 hours. It's an appeal process if they disagreed with it, but we have had family meetings to go through what the needs are, discharge needs.
So you mentioned appeal process. Explain to me what is this appeal process?
So if any home health care company were to end or increase or decrease their frequency of visits, a notice is provided, and it's a notice given, the patient signs. They're not signing that they agree, they're signing that they were notified, and there's a number to call to appeal, which would prompt a review of the medical record to see if their skilled services should end or if there's more that could be done.
Sure. Example, the caregiver does not show up, and how the family communicate this? How do you communicate this with the family? And do you find replacement ASAP, or is it the following day? And what is basically the policy of communicating with no show up with the family?
We don't have no show from the staff.
Yeah, your
We've
staff,
had
basically your staff didn't
Yeah.
show up in patient's home. And
Yeah.
then how do you communicate this with the family? And what
Yeah.
is your policy of no show at
Right.
work?
So the family, the patient, they have multiple means of getting in touch with us. There's a number to call 24/7 that a live person answers, or will call you back within 15 minutes. There's the number of the clinical manager on the case to call as well. And if somebody doesn't show up, the family would notify us, I suppose. But for the most part, there's a lot of, if things aren't daily, if therapy is 3 times a week and the patient has a doctor's appointment on one day, it's shifted to a different day. So we often are moving things around, or we're swapping out visit times, things like that, to make it work for the patient.
There is a conception always that if the patient is under home care services, they're not allowed to go out of the home, or else the home care service will discharge the services once patients go out. They're supposed to be homebound while having home care services.
Right.
Can you explain me about this? Because a lot of cases I talked in before, they're not allowed to go out. What if they just want to have a one-night dinner with their family? Would that cut off their benefits from home care services?
That is something that Medicare CMS has looked at and clarified recently, that you can still receive Medicare provided services, even if you go to adult day health programs, going to church, doctor's appointments, an occasional haircut.
Okay.
But it's more about what is the need to bring the services to the patient. Is it a taxing effort to leave home? Can they not navigate the stairs without assistance?
Right.
So what are their needs versus how good is it going to be for them to go out to dinner with their family? Is that going to be beneficial to them, and are they safe?
Okay, perfect. Good to know, because it's been like a lot of people
I
say,
know.
oh, if I go out from home, they will cut my
Right,
services from home
right.
care.
It's important to ask the home
Correct.
care
Thank
company,
you
but yeah.
for explaining that, for clarifications. And sometimes the family wanted to continue therapy, but you discharge them because you think they're self-sufficient already enough. And sometimes they're willing to pay privately. Do you accept that?
We do. It depends upon the patient, as long as it is something that's reasonable and safe to be done in the home, that we can provide private pay.
Sure. So
services.
since we're talking about money here, so what are what are forms of payment do you accept? And what insurance do you accept as well? And is the rate for nights, weekends, and holidays different?
Overall, the insurances that we take for now is Medicare. We are waiting for Medicaid, and once we have Medicaid, it opens up all
lot.
different insurances. Yeah. When it comes to private pay, it's looking at the patient's complexity, what they need, how often, how long would a visit be from a nurse, from a physical therapist, from somebody, and then really discussing it with the family and the patient in advance. But there's not a different rate it wouldn't usually be nights or weekends.
Yeah, example, you have a
Correct.
patient come to you and you're serving the patient at home, then down the road you realize that the patient has more of a psych problem. Do you have provider for this as well, this kind of patient?
There's a lot of patients that they may have had their knee replaced, but they have depression and anxiety or bipolar disorder, And that's not anything that changes how we treat them.
Okay.
But we do coordinate with if they already have a community provider
Perfect.
for that. And our medical social worker is very good at working with any issues that may heighten as they return home, especially anxiety.
Perfect. To end this episode, can you please give an advice family at home in choosing right for home care services?
So home care services, especially as a Medicare beneficiary, it's always a patient's choice. You can choose whatever company you want. Doesn't have to be affiliated with the hospital or the nursing home or anywhere that you're coming from. It is up to you, and it's best, I think, not just for home health, but for any type of care you're seeking, to ask around. Call your senior center, ask friends, see if they have anybody to recommend, and often you find the best results with that. But always know that you do have a choice in your provider.
Okay, for the last and again, to tell them what Eden Health Service, home care service can offer to them.
Well, Eden Home Health Care, it will proudly serve you in your home, with individualized care, and take your independence, your highest quality of life as our top priority. Eden Home Health Care, we believe that the first health is wealth, and we stand behind that. Eek.
Thank you so much, Amy.
Thank
For
you.
your help.
Thank you
Thank you
very
for
much.
coming. Thank you so
Thank
much.
you for having me.
At its basic level, home health care means exactly what it sounds like: medical care provided in a patient's home. Home health care can include broad care given by skilled medical professionals, including skilled nursing care, physical therapy, occupational therapy, and speech therapy, and medical social worker. Home health care can also include skilled non-medical care, such as the social services and assistance with daily living from a highly qualified home health aide. As the Medicare program describes, home health care is unique as a care setting not only because the care is provided in the home, but the care itself is usually less expensive, more convenient, and just as effective as care given in a hospital or nursing skilled facility. Again, this is Rudy. This is Senior Matters. Thank you.